So a 47-year-old woman presents to the clinic for regular health checkup. She is currently asymptomatic but gives history of recurrent bout of right upper abdominal pain for past 3 years. She further describes the pain to be intermittent and localized. She denies any fever, vomiting, difficulty breathing, abdominal bowel sounds, hematemesis, melena. She is currently taking multivitamin only. She's used to take combined oral contraceptive pills but stopped 3 years ago. The temperature is 36.7. The blood pressure is 126 over 88. The pulse rate is 84 and respiratory rate is 12. The blood workup is normal. Abdominal X-ray shown here, you can see. And based on this imaging finding, what is she really risk for developing? Okay, so the answer is here. So let's see what the patient is having. The patient was having recurrent episodes of right abdominal pain for 3 years. So this is classic for whoever having chronic cholecystitis. So whenever patient is having chronic pain in the right upper quadrant, so we have to suspect of having chronic cholecystitis, and this can eventually progresses to have porcelain gallbladder, which is a dystrophic calcification around the gallbladder wall, and this usually progresses to have gallbladder cancer. And what is the treatment? We remove the gallbladder, that is cholecystectomy for this patient. Okay, so this patient is having a risk for gallbladder cancer. Let's go through a little bit of notes. So as I said, it's a chronic cholecystitis this patient was presenting with. She was having chronic inflammation of a gallbladder, and due to this chemical irritation, a long-standing cholelithasis with or without superimposed acute cholecystitis. We can see, and usually the uh, cholecystitis, they have a sinuses that is called Rokitansky ash of sinuses, which is characteristics of chronic cholecystitis. So this patient, they have a specific sinuses or called histological mark that is called Rokitansky ash of sinuses that is characterized by herniation of gallbladder mucosa into the muscular wall. So usually this patient, they can present with vague right upper quadrant pain, and that is especially after the eating. As we seen, the porcelain gallbladder is late complication, which is a shrunken hard gallbladder that is due to chronic inflammation and fibrosis and causes to have dystrophic calcification, and this increases the risk of carcinoma. And the treatment is cholecystectomy, especially if the porcelain gallbladder is present. You can see here, calcified gallbladder due to chronic cholecystitis is found incidentally on imaging. The treatment is prophylactic cholecystectomy, generally recommended due to increased risk of having gallbladder cancer, that is adenocarcinoma.
Thanks for watching. Please give a thumbs up and subscribe for more.